Okay, so for a long clinical consultation, we have 15 minutes with the patient. Within this time, we should take the proper history and do relevant examination and uh, meet the patient concern appropriately and formulate a management plan for the patient. So for clinical consultation, we can divide it the station 15-minute station into several parts, and uh, for easier way, I used to divide the consultation station into 15 points, where I started the consultation station by introducing myself. Uh, Hello, I'm Dr. Hussein, one of the doctor here today. Then I used to confirm the patient name. May I have your name, please? And um, in in these type of station, you must need to confirm the age of the patient or sometime the date of birth of the patient. No need to go for the date of the birth of the patient. Just confirm the age of the patient and greet the patient and address him with his or her name. So you can say whether the patient is comfortable there, and you have to set your agenda that today we are here to discuss about the health condition of the patient, and you have to reassure the patient that uh, our whole discussion will remain confidential. And then you have to explore the primary symptoms or many symptoms if the patient having. So you can ask, what bring you here today. You have to ask this question very widely to provoke the surrogate to answer it elaborately. So patient will tell you that they might they he is having or she is having um, the symptoms for last few days, and the symptoms is quite bothersome for her, and some of the few clue uh, may given by the surrogate a very earlier part of the discussion. So you have to uh, tell the patient to uh, allow the patient to tell herself, and give him or her some time to elaborate the complaint. And the third part is you have to ask the patient that do you have any other problem. This question is very important because sometime specifically in Indian centers, when you ask this question, they can tell you one or two more symptoms which are very important to reach the diagnosis. So my way is you have to introduce yourself, ask for the presenting complaint, what brought you here today, or I understand that you've been having some chest pain or cough. Could you please tell me more about this? And third part is you have to ask about the other problem. Do you have any other problem you want to share with me? And then you have to explore the symptoms one by one. We call it symptom analysis. For a patient with confusion, we will go to the confusion uh, later part of our discussion. But for any symptoms, you have to explore the symptoms. We can ask the fast onset, course, duration, exacerbating factor, relieving factor, and anything, any other associated symptoms. So, is it the first time you've been experiencing this problem? And for the onset, is it appear suddenly or gradually? And for course, is it gradually worsen or is it gradually improving? Or what do you think about the progression of your symptoms? And how long have you had this for? Do you have any previous attack, or this is the first time? And is there anything make it worse? Is there anything make it better? And with this symptom, do you have any other symptoms? And from the symptom analysis, you should reach the diagnosis at this point. And mm, after confirming the diagnosis or differential diagnosis, you have to find out the complication, like from cough. If you diagnosed this is a case of bronchial asthma exacerbation, you need to find out the cause, the triggering factor for asthma exacerbation. And you need to ask the complication that might associated with an asthma exacerbation, like mm, bluing of the leaves. This is one. And some question regarding the differential diagnosis, and the red flags, if there are any. Like in a case of headache, you need to ask the red flags. In case of back pain, in case of diarrhea, every symptoms have some red flags, so you need to ask that red flag as well. And then we can go for the corresponding symptom analysis. For example, if this is a case of confusion, you need to explore the neurological system first. If it is a case of palpitation, you need to explore the cardiovascular system first. And for the sixth point, you need to go for the past medical condition, medication history, family history. And for female patient, we all know that we need to ask about the pill period and pregnancy. Then you need to go for the appropriate all the symptom analysis, like from the general symptoms to the abdomen, respiratory, uh, neuro, renal. You need to explore all other symptom, all other system analysis. For general and symptom analysis, we tend to ask about the temperature change, any yellow coloration, whether they think they are getting pale day by day, any mouth sore. And with the general part, we used to explore the rheumatological system as well, like any joint pain, rash, or change in the weight. For neurological symptom analysis, we tend to ask about the headache, any problem with vision, any dizziness on standing, any weakness in any body part, any tingling sensation, any numbness, any history of feet or loss of consciousness. For respiratory symptom, we tend to ask, we started with a broad question: do you have any chest problem? No, I don't. So you can also ask about the cough, any shortness of breath, any chest pain. For cardiovascular system, do you have any heart problem? Have you ever noticed a racing pacing of heart, any chest pain, any shortness of breath when especially on lying down, any ankle swelling? For abdomen or gastrointestinal system, you can ask about the tummy problem, heartburn, a change in bowel habit, anytime passes of blood or bloody stool, black or bloody stool. For renal system, we used to ask about the water work, the amount, color, frothiness, any burning sensation while passing water work. And then the number 8 point, we tend to ask about the mood, diet, travel, and sexual history. For mood, we ask the patient, could you please describe your mood for last few days? They will describe their mood. We also ask about the diet. Do you follow any specific diet? Sometimes patient may follow a vegetarian diet. We also ask about the travel. The travel history is important in case of fever, infective endocarditis. In case of jaundice, the travel history is very important there. And for travel, you need to ask, do you recently travel anywhere? And also, this is also important in case of diarrhea. Sexual history is also important if it is appropriate. So if the patient is you think the patient is sexually active, you need to and your history is suggestive of something related to uh, sexually transmitted infection, then you need to ask about the sexual history. But before sexual history, you need to give some warning shot. You can say the patient sometimes some disease can caused by sexually transmitted infection. And may I ask you some very personal question? And it's completely okay for me if you don't want to answer. So then you can jump. Do you have any long-term relationship? Yes, doctor, I have long-term relationship. I'm sorry to ask, but it's important for me. Could you please tell me, do you have any unprotected casual sexual relationship? So you have to explore the sexual history as well if it's relevant. Social history, for social history you need to ask about the smoking, drinking, um, uh, living, and impact of the disease in their daily life. So you have to ask whether they're a smoker, whether they drink, what they do for living, and how much their symptoms affect their daily life and job. I always prefer summarization. Summarization is very important. So for summarization, um, you can start it by now. Now I'm going to summarize what we discussed so far. Let me summarize what we discussed so far, and it's completely okay if you want to add or modify anything. Please do so. And then after summarization you go for the examination. The examination should be very systematic and very focused. You don't have too much time for detailed examination, so keeping this in mind, you have to be very focused on examination. And number 12 point is the concern. You have to ask about the concern. You have to ask, do you have any concern? Uh, they will definitely have concern, more than one concern. They usually have two to three concern. So for the concern, you have to you need to say to the patient that you understand their concern and what they are concerned about, and you try to uh, meet their concern. And after that you need to explain your diagnosis or differential diagnosis, and the investigation you want to do, and specialist you want to involve. You have to give them a decision whether they need any admission, observation, or any treatment. And number 15 is also very important. You need to stop something. There is always something we need to stop, and there is always something we need to start, like for a vision problem, in a patient with vision problem, we need to stop the driving. We also need to give give patients some advice regarding smoking if they are a smoker. So like this, and sometime medication, some medication we need to stop, like if the patient recently started thiazide and develop joint pain, you are thinking about gout attack. So you need to stop that medication and explain the patient that this medication is directly related to the symptoms, and I advise you to stop this medication. And what you need to start sometime for pain, if the patient is on pain, so you need to start the painkillers. So this is a structured a way to perform a clinical consultation station. And uh, when we are structured, it's very easy to perform clinical consultation station. So we will explore the case of our today's case, which was a case of confusion. I will discuss that case with you now.